Hello.
Yes, sir. We could hear you. Please go ahead.
Okay. All right. So I'll just say next slide. So my name is Bode Palashe. I wish I was there in person. I'm here in Nigeria, in Abuja. We're currently on a mission with Cardiostats in Abuja. Next, so I'll be presenting on behalf of the Nigeria Open Heart Surgery Registry collaborators, giving an update on our registry. Next slide, please. So by way of introduction, yes.
Sorry for the question. Can you please move your camera to the landscape mode so it will be having a screen camera? Yes. Thank you.
Okay. All right. Now, Open Heart Surgery Nigeria has been on since 1974, 1978, but there hadn't been much data regarding open heart surgery, just a few publications. So we decided to come together to design and start a national registry. This registry is available online. If you would like to Google the Nigeria Heart Registry, the first hit on Google will give you the registry. So you can follow me along in this presentation. So what I'd like to do is just give you a few highlights from our registry. So we started the registry formally in 2020, supported by both our Cardiovascular and Thoracic Surgeons Association and Nigeria Cardiac Society. Next slide, please. Now, the registry is internet-based, can be accessed by any device that can access data, PC or phones. And that's the website, nigeriaheartregistry.com. It was designed with a database engine called Bridge, and it's funded currently by an educational grant by Cardiostat International and Edos Life Science. It is funded annually. So we've funded for the last 3 years, and we have funding till 2024. There are currently 23 contributing institutions as listed. Actually, it is now 24. There are 10 in the public sector and 14 in the private sector. Next slide, please. And the database shows the different collaborators by the different institutions. Next slide, please. This is just a snapshot of the back end, the Caspio Bridge. It shows that anybody who can design things in Microsoft Access or SQL can easily do this design, and you can then deploy the web to a web page. Next slide. Just showing that it is very similar to Microsoft Access. You have forms, you have tables. The forms are called data pages. Next slide. So we decided on a very minimal data set to allow for easy data entry. So we pick these fields as displayed: age, sex, gender, primary and secondary diagnosis, a Euro score, the date of operation, the findings, a brief description, bypass across clamp times, temperature, cardioplegia, complications, and outcome. So within really 2 minutes, any busy surgeon can enter the data. Next slide, please. This is just how the database looks. On the left, this is how it looks on the phone. On the right, how it looks on the PC. Next slide. Next slide, please. So I'm just going to take you through a few of these links that will summarize what we can get currently from our database. So we have pages that are available to the public, which what I'm going to show you. And on the blue arrow, there are private pages that require secure access for institutional login. Next slide, please. And as I said, it's funded by a grant from Cardiostat International and Edos Life Science. Next slide, please. So this shows that from January, please go back. So this shows that from January 2004 to 2023, we have currently logged on just under 1,500 cases, and it shows the different institutions. the main take-home from this graph is that more and more institutions are now contributing to the registry, and there's an upward growth in the number of cases being done in the country. It's not huge. So far this year, 257, but the trend is upwards as shown. Next slide. This shows that you can see the activity breakdown as a table from each different center. Next slide. And this shows the total activity by the various institutions. So you can see that there are at least 1, 2, 3, 4, 5, 6, 7 institutions that are doing the bulk of the surgeries, but there are smaller numbers from other institutions. Next slide. This shows the activity so far this year. As you can see at the bottom, there are 257 cases done so far this year. You can see the names of the different institutions that have been doing these surgeries. Next slide. It's with Africa, Nigeria, cost of surgery is very important. So we have on our database the cost of surgery benchmarked to my institution, which is a public institution. At the moment, it costs us about $4,700 to do a mitral valve replacements, and this is accessible to anyone. Next slide. And on our database, you can see that we have information on the items, the supplier, the number of items required for surgery, and the cost. So it allows any institution to simply reference this so they can do their stock of procurement and plan for surgery from this list. Next slide. This just shows that every month, an average of about 17 cases are done in the country on a monthly basis. So it's not an ad hoc thing. Surgery now, no surgery in 6 months. There's continuous monthly activity in the last 5 years. Next slide. This shows the distribution of adults and pediatric surgery across the different institutions. So among ourselves, we know who's doing adult cases, we know who's doing pediatric cases. Next slide. And you can see that we have gradually grown from the point where in 2004 was mainly adult surgery to what it is now, where we have essentially 50-50 between adult surgery and pediatric surgery. Next slide, please. This shows that, sorry, there's something on my screen here. So this shows here that overall adult surgery is about 54% and pediatric surgery about 55% of the overall activity. Next slide. Now, looking at the adult cases, most common adult cases are mitral valve replacements, mechanical, followed by CABG, ASD, and AVR, and double valve. Next slide. And you can see from this, adult cases, single valve cases form the majority, but closely followed by congenital and CABG for adults. Next slide. Looking at the pediatric cases, it's mainly VSD repairs and TOF repairs, TOF corrections, followed by AVSD and ASD repair. But please note that a wide spectrum of cases is also done. So essentially now in Nigeria, we do cover, I would say, the entire range of regular adults and pediatric surgery across the different institutions as captured in the registry. Next slide. So overall, interestingly, this shows that looking at all procedures, adult and pediatric, congenital surgery forms over half of what we do because many adults present with congenital heart disease, and then followed by single valves and CABG. Next slide, please. This just shows a breakdown of single valve prosthesis, showing that the majority of valves implanted are mechanical valves and very few repairs being done. Next slide. So with this database, you can contrast what happens when a patient goes to see the cardiologist. Before we started the database in 2019, you see your cardiologist, gets a diagnosis of tetralogy of Fallot, patient goes online to Google it, talks to their friends and relations, and may often decide that there's no surgery in the country, and they have to go out and fly out of the country, or the cardiologist advises them to go out of the country for surgery. Next slide, please. But now with the database, all the person needs to do is go online and Google the Nigerian Open Heart Registry, and it's the very first hit you see on Google. Next slide. And we have a search page called Where to Get Surgery. So if you type in, for example, the TOF total correction, next slide, the database will eventually tell you that IFE has done 36 cases, Babcock has done 70 cases, UNTH 30 cases, and which years they have done them. So the person searching, whether a patient or cardiologist, can decide where to send their patient to. Next slide, please. Now, who is doing the cases? This is my favorite slide. You can see that the visiting cases by visiting teams in blue was how we started in most institutions. But gradually, in green, the local teams have gradually been doing more and more. So right now, 70% of cases are being done by resident teams in the country. Next slide, please. And this also shows which institutions are doing surgery on their own, which ones still depend on visiting teams. It's a gradual transition, but we're hoping that eventually almost every institution can do surgery on their own. We'll have to wait for visiting teams. And I've already shown this. This just shows the activity this year. Next slide, please. So in summary, with our registry, we now have an online open heart surgery registry. It's easy to input data with minimal fields. It takes 2 minutes to input the data. We currently have 24 institutions that contribute data. It shows that there's been a rapid growth of activity in the last 5 years, and there's now a wide range of adult hepatic surgery in the country done by local teams. Next slide, please. There's still challenges. It's often difficult to get surgeons to input data themselves because they're busy. So I often have to chase people, but it's getting better. By not having the data done at that point in time, that sometimes introduces errors. But as the data manager, I have to tidy that up. So we need to evolve to ownership of our data to more accurately reflect our practice. Next slide, please. Not all institutions are contributing. Please go back. Not all institutions are contributing data. If we can get more colleagues and more institutions to join us, then the registry will be even more representative of our national practice. Next slide. Challenges. These things cost. At the moment, it costs us $5,400 per annum for the website and Casco Bridge. Thankfully, Edo's Life Science and Cardiothoracic have been funding this for the last 5 years. We have funding secured for 2024. But the problem now is, can we get sponsors to help us to continue this online registry? I would hope we can get sponsors to pay ahead so we don't need to worry every year about being able to continue our registry. So we're looking for sponsors, grants, anything to help us to continue. Next slide, please. So in conclusion, this voluntary registry is in the public domain, and it gives physicians and the general public access to hitherto unavailable data about open surgery in Nigeria. A wide range of procedures are now available by resident teams. So we are no longer dependent on visiting cardiac missions in both the public and private sector. And with good registry data, we're gradually building confidence of colleagues and the public to have surgery in Nigeria and reduce medical tourism. Thank you for listening. I can't hear you. The sound hasn't come back on.
can't hear anything at all.